We are joined by Dr. Mark Thomas from Washington Regional Medical Center in Fayetteville. He is the Vice President of Population Health and Medical Director of Clinics. We want to answer your questions about COVID-19 and its impact across the country and right here at home. Again, we invite you to send in your questions about coronavirus through text 5. You can send those messages to 479-783-1191. And if you're watching this segment back online afterward, keep in mind this is a fluid and evolving situation, so information we share right now may change in the future. Dr. Thomas, welcome. Thank you for being here.
Well, thank you for having me.
All right, let's start with, we have our first confirmed case of COVID-19 in Washington County in Fayetteville. Where do you think things go from here, say in the next week in Northwest Arkansas and the River Valley?
I think it's without question that we're going to have more positive cases. You know, the amount of positive cases that you have are directly related to the amount of testing that you've been doing. We are operating a coronavirus clinic at Washington Regional, and we've seen well over 200 patients there in the last 3 days. Many of those patients have been screened, and so we expect to be hearing from our testing sites those results relatively soon.
I know you are on the front lines. Do you feel like Washington Regional is prepared for COVID-19 and will continue to be prepared in the weeks to come?
Well, first of all, preparedness to something novel like this is very difficult.
Sure.
But I have to say that Washington Regional has been prepared for a pandemic really for over a decade. We have been stocking supplies for this kind of a circumstance. We've also been planning around the clock for the last few weeks in setting up procedures and policies at the medical center to protect patients and to care for patients as well. Just to go through some of those things, the first thing is we are, as you know, people have tried to visit Washington Regional know, we are limiting some of the visiting hours, and we're limiting screening all people coming in to visit in the hospital. Just today, we started screening our employees as well as they come in the hospital, screening them for fever, screening them for exposure to COVID-19 cases, and also screening them for any symptoms. I have my badge on. I'm allowed to go into Washington Regional today, but things might change tomorrow.
Sure.
And so I get screened again. And so every day I need to get into the hospital, I'll be screened.
And to be clear, screening and testing are two different things, right?
That's a really good question. And we struggled as we planned for this, the distinction between the two.
Yeah.
So screening is a screen for risk factors for symptoms of the virus. And this is quite important. Right now, testing, because of the limitation of testing supplies still, we're testing people who are positive for the screen and also positive for the priority risk factors set by the Arkansas Department of Health.
Okay. So that kind of leads into my next question. Do we have enough test kits, and who should be tested if everyone can't be tested, which clearly at this point we cannot?
We need more test kits. There's no question about that. I'm confident that both the Arkansas Department of Health as well as the other private testing labs will be able to increase the production and availability of the tests over the next days to a week or 2 weeks. The test supplies have improved a little bit today from the day before, but we're still in a relative shortage, so that we have to prioritize people who we test. And those people right now are people that have symptoms of the COVID virus, which clearly are coughing, fever, and possibly shortness of breath. If they have those symptoms and then meet one of the other categories, the first category is anyone over 65. We know that people over 65 are at greater risk of severe complications from this disease. The second group are people that have significant comorbid conditions, heart disease, lung disease, kidney disease, cancer, or people who are immunocompromised, either because of their disease process or the treatment of their disease. Finally, we also are able to screen people who have symptoms of the COVID virus, who also have had a contact with a known proven COVID-19 case, or people such as healthcare workers who we rely on to provide healthcare. We need to make sure they're safe.
Right.
And then finally, people who have traveled to one of the 5 endemic areas. Now, clearly, travel to the 5 endemic areas is not what we worry about in Arkansas that much.
Sure.
But we have had people traveling from outside the state even. So we need to be very sensitive to people who are traveling from areas in the United States that are now endemic.
All right. Thank you so much, Doctor. We have many more questions to get to, many more specific questions coming up here in just a few moments. First, though, let's send it over to Garrett for a look at your traffic. All right, Garrett, thanks. Back now with Dr. Mark Thomas with Washington Regional Medical Center. We are taking your questions about COVID-19 to bring you the facts, not fear, about the coronavirus. A number of questions that we've gotten from people, Doctor, has been about social distancing. We've heard the President, the CDC, talk about the recommendations of social distancing, including that if you're in proximity with other people to stay at least 6 feet apart. How long do you think people will be asked to comply with those, and why are they so important?
Well, first of all, it's key. Social distancing is key. At Washington Regional, we have a unit in the hospital that's separate from all the other units in the hospital, where staff have special protective equipment, as well as where the patients with suspected COVID virus would be placed when they come into the hospital. So that's important. And I must say, when I came here today to your studio, all of your staff were very good at social distancing and keeping that 6-foot distance. So I was very impressed. Good work.
Thank you. That's something that's important to us here as well,
Yeah.
because we have to keep kind of
Yeah.
fighting and being
Yeah.
present to cover
Yeah.
these stories too.
But it is quite important. 6 feet, I think, would be a safe distance. Obviously, that has to do, really changes people's lives in really serious ways. And at the same time, we know that some people can't maintain that distance because they're caring for a sick elder or someone at home or a patient with special needs. And so those are all special cases. But it is quite important. The droplets from COVID virus are spread through coughing. And we feel that if you're 6 feet away, the risk of exposure is less. The other thing to remember is that those droplets live on surfaces for hours, days, perhaps. And so cleaning those surfaces, cleaning your hands regularly, 20 seconds of hand washing, or using 60% alcohol or more is very important. Your question about how long, we don't know. We simply don't know how long. I think it's safe to assume that most outbreaks and epidemics like this last many weeks, maybe months.
Right.
And so I think that looking through March into April, through May, into June, is something that people should be preparing themselves for. This is a marathon, and and frankly, I have to say, I think I'd be happier if the outbreak lasts a little longer, because that means we've managed to suppress the number of cases in such a way as that the growth wasn't as high. That we were able, you've seen signs around this, it says flatten the curve. It's kind of reducing that growth rate of the number of cases so that hospitals and healthcare providers and services don't get overwhelmed.
Right, and that impacts what you do every day, right? I heard another infectious disease specialist mention it as the COVID-19 winter as opposed to the COVID-19 blizzard, right? And that difference of a longer period of time versus
That's a great
sprint
analogy.
versus a marathon, right?
That's a
All right.
great analogy.
Thank you, Doctor. We'll be back right after this break with more of your questions. Back now with Mark Thomas with Washington Regional Medical Center, taking questions about COVID-19. I know a lot of people have talked about the impact on their households, and then people that are potentially expecting. Obviously, there's a lot of expecting mothers out there. How can coronavirus impact someone who's pregnant?
Well, that's a fantastic question. You know, I've encountered a couple of young women at our screening clinic. First of all, we don't know a lot about pregnancy and COVID virus, but we do know that people who are pregnant have just as much risk of catching the virus. We hope that their symptoms are less severe. We know from other epidemics like flu that sometimes pregnant women could have worse symptoms. So if you're pregnant, talk to your OBGYN and get advice from them. Try to shelter at home. Try to protect yourself at home from other people at home who may have symptoms of the virus. That may be sheltering in a different room. It may be using a different bathroom if available. It could be using different utensils. Obviously, you need to do that. But cleaning surfaces in your home every day, at least once a day, with appropriate cleaning solutions. And then also being very careful when you're coughing and sneezing to make sure that you have a tissue or covering your mouth. And finally, making sure that you're washing your hands. Wash your hands. If you wash your hands, you'll be okay.
Good. That is definitely good to know. I know someone had asked about the virus being able to linger on their clothing and spread in that way, and you had messaged there is the possibility of that.
I think it would be, especially someone who has the COVID virus, you want to launder their clothes. If you can, use gloves to take the clothes to the laundry and then launder them just the usual way you normally do.
Okay.
If you can't, then good hand washing again afterwards.
All right. Great advice. Thank you, Dr. Thomas. We appreciate it. We'll be right back. Well, we want to thank everyone who sent in their questions for Dr. Thomas with Washington Regional Medical Center today about COVID-19. And Doctor, we'd like to leave you with the final thought. What would you like people to know?
Well, first and foremost, I want to thank my colleagues at Washington Regional, the physicians, nurses, and other healthcare professionals who are on the lines every day. We're doing all the work we normally do, plus twice as much.
Right.
So hats off to them. Our leadership and board at Washington Regional has been extremely responsive and really has led the charge to make us as prepared as I think we can be for this. And finally, I'd really very much like to thank the people of Fayetteville and Northwest Arkansas. I've met hundreds of them over the last few days at our coronavirus screening clinic. And to a person, they have been generous and they've been kind. They have recognized when they're not one of those high-risk groups. They've been receptive of information from us. And they've recognized that we're all in this together. And that if they can follow a few simple principles and a little bit of patience and not be scared, not be panicked, that we're going to all get through this.